Good afternoon, everyone, and welcome to the Chamber's Business Beat Speaker Series. I'm Bruce Stidworthy, Chamber Board Chair and President and CEO of Bohannon Houston. Thank you for joining our virtual event today, the final installment of our Business Beats events this program year, allowing for the business community to hear directly from high-level experts and decision makers on timely and relevant topics. Today, we're excited to talk about the upcoming election and the important mill levy and general obligation bonds questions on the ballot, specifically how they will impact our flagship university, the University of New Mexico, and our community at large. We'll hear from University President Garnett Stokes for an interview on how critical this funding is to UNM's many missions. Then we'll have a deeper conversation with senior UNM leaders about three specific areas that are relying on these initiatives to pass, namely the University Hospital, the Pharmacy School, and the College of Arts and Sciences. And why that's of utmost importance to the community. Before we jump in, I'd like to recognize some of the really great companies and organizations who are sponsoring today's event. Those sponsors are UNM Resources, President and COO, Don Terry, New Mexico Mutual, President and CEO, Kelly Mixon, the University of New Mexico and its President, Garnett Stokes, including UNM Health Sciences Center, UNM Health, UNM Comprehensive Cancer Center, UNM Athletics, and UNM Rainforest Innovations. Bernalillo County, Manager Julie Morgus-Baca, City of Albuquerque, Mayor Tim Keller, Avangrid, CEO Pedro Azagra Velasquez, French Funerals and Cremations, President and CEO Tom Antrim, Central New Mexico Community College, President Tracy Hartzler, Blue Cross and Blue Shield of New Mexico, President Janice Torres, New Mexico Gas Company, President Ryan Shell, Excellent Schools New Mexico, Executive Director Scott Heineman, U.S. Bank Business Banking Sales Manager Howie Herbert, Hartman and Majewski Design Group, CEO Doug Majewski. Thank you to these great sponsors for their engagement and generosity. We appreciate each of you. To get us kicked off, I'll bring Chamber President and CEO Terry Cole into the conversation. Terry will introduce President Stokes, and after President Stokes' comments, she'll introduce the senior team members she brought with her today. And we'll take the conversation from there. Terry?
Thank you, Bruce. And President Stokes, welcome once again to the Chamber's Business Beat. This is President Stokes' third time sharing vital information with us, and we are so appreciative of her and her team sharing their time and expertise. She's the 23rd president of UNM, has served in that role since 2018, and is the first woman to hold the post. She's a first-generation college graduate, earned her BA in psychology from Carson Newman College in Jefferson City, Tennessee, and her MS and PhD degrees from the University of Georgia in industrial organizational psychology. We honored President Stokes with one of our top chamber awards a few years ago, and our appreciation for her even temperament and positive vision continue today. She's made hard decisions and led the institution with integrity, from navigating budget concerns and ensuring student safety to guiding the university community through the global pandemic and prioritizing critical capital projects that will serve our campus community in Albuquerque and New Mexico. We honored President Stokes. We've appreciated your engagement with our business community and partnership on a range of issues. Please give us your top of mind thoughts about the upcoming mill levy and bond questions, why these should be high on the average voter's radar. Then please introduce us to your team members you brought with you for today's program.
Thank you, Terry, and good afternoon, everyone, and thank you for this opportunity to ask you to keep UNM in mind when examining the very crowded ballot that we'll see in November. You'll hear about two vitally important ballot initiatives, both of which reflect our commitment to advancing New Mexico. So if we could go to the next slide. That we're meeting today's panel. So the first, I think we've missed a slide here. So the first slide is the powering progress, and it mentions what I've just stated. And then we will go to the next slide, which is I want to tell you a little bit about the ways in which UNM has really been grateful for the ways in which the GEO bond funds appropriated by the state have been able to help us. Since the 2008 bond, UNM has received, if we can get to the second slide, there it is, more than $316 million in funding. And so before talking about the upcoming ballot initiatives, I'd like to share some of the highlights of the incredible benefits to UNM and the citizens of New Mexico that could not have been made possible without the general obligation bonds. And the first one that I want to mention is, of course, something I think you're all familiar with, which is the New Mexico's only comprehensive cancer center, which is one of the nation's 60 premier national cancer institutes that's designated as a cancer center. It has served a large number of New Mexicans, and the center, which opened in August of 2009, it opened at a cost of $100 million, has 206,000 square feet of clinical space spread over 5 stories, and hosts the state's largest team of cancer specialists. On the next slide, I want to mention, we already know how important the film industry is in New Mexico. A $4 million advanced teaching and research facility was approved for construction located next to Albuquerque Studios. Now it's called Netflix, and the planned Sony ImageWorks campus. This facility, which formally opened in November of 2010, spans 3 floors, housing the film and digital arts department with advanced classroom and laboratory spaces, contributing to the growth of a native New Mexican Hollywood and to the state's economy. On the next slide, I want to mention the Domenici Center for Health Sciences Education. It's a state-of-the-art advanced teaching and research facility equipped with cutting-edge teaching and technology and resources essential for modern medical education. And we know how crucial that is for us. It fosters collaboration among different health science disciplines and enhances the quality of education and research by promoting an integrated approach to healthcare. It also plays a critical role in training future healthcare professionals and ensuring that they are well prepared to meet the evolving needs of the healthcare industry. The next slide mentions yet another GEO bond, upgrading and consolidating the ROTC facilities. It allowed us to bring together the Navy, the Army, and the Air Force programs, which has helped us enhance the training environment for future military leaders by consolidating and modernizing the facilities for all of these branches at the university. The new 20,600 square foot facility, which opened in May of 2023 at a cost of $10.8 million, includes classrooms, offices, a conference room, and student areas to support the training of college students who become commissioned officers in the U.S. Armed Forces. And on the next slide, we mentioned the Health Science Nursing and Population Health Building, which was funded in 2020. This new facility will address increasing undergraduate enrollment in the College of Nursing and Population Health. It will help mitigate the state's healthcare workforce deficit. This is a facility that will open this summer, and it will include instructional spaces, student support areas, department offices, and research facilities. It will also free up space in the current nursing and pharmacy building for the consolidation of our pharmacy program. And then the next slide, this is our most recent successful bond project. It's an investment in the creation of a new 62,100 square foot Center for Collaborative Arts and Technology. And what it will do is provide a signature space for the College of Fine Arts, which is spread all over campus in 13 different buildings. This facility is scheduled to open in 2026, and it will include exhibition spaces, a sound stage for film students, and a large performance hall, supporting student success and serving as a hub for New Mexico's growing arts community. And of course, on the next slide, we've had our branch campuses that have benefited greatly from the GO bonds to serve the distinct communities that we have in Gallup and Taos and Los Alamos and in Valencia. And, you know, in this way, I think we're proud to be the university for New Mexico. We look forward to working with all of you to serve the state. And with that, what I'd like to do is turn over the presentation now to some of our outstanding UNM leaders to speak about what is at stake on the 2024 ballot for UNM and for New Mexico. So today's presentation, on the next slide, you'll see our three speakers today. First is Kate Becker, who is our CEO of UNM Hospitals. Don Godwin, who is our Dean of Pharmaceutical Sciences. And Jennifer Mallett, who is our Dean for the College of Arts and Sciences. And with that, I will let Kate kick us off with the Bernalillo County mill levy, which comes before voters every 8 years. Thank you, Kate.
Thank you, President Stokes, and Terry and Bruce. Thanks for having us today. If you want to go to the next slide, I'm here to talk about the Bernalillo County mill levy. So those of you who have lived here a while know that this comes up every 8 years. This will be the 9th time, 70 years now, 72 years, that the voters of Bernalillo County have been voting on this mill levy to support the operations and maintenance of UNM Hospital. And one of the things that we just wanted to share a little bit was why UNM Hospital? What makes us unique? You know, why do you need to support us compared to any other hospital? What services do we provide to everybody in the county that's worth supporting, right? Next slide. So this is a little bit about who we are and some specific things that are what we call the ones and onlys. And I'm going to talk in a little more detail about each of those. We're also New Mexico's only academic medical center. So we are educating not only physicians and not only nurses, which is what everybody thinks of when they think of healthcare workforce, but everybody else. On any given day in our hospitals and clinics, there's somebody from every single kind of healthcare work being trained, whether it's a radiology technician, a pharmacist, a nurse, a doctor, all of those folks. And some of them stay and work with us, which is great. Some of them stay in Albuquerque, which is also great. And some of them go elsewhere in the state. So more than 50% of the doctors in New Mexico trained here, more than 60% of the nurses trained here, and more than 80% of the pharmacists trained here. So it's a really important resource for the workforce that we all need to have access to healthcare. We also employ a lot of people, which, as you know, from a chamber perspective is important. These are good paying jobs, and we employ almost 8,000 people at the hospitals and clinics. So that's important to us. Next slide. This is a slide from an advertising campaign we have running right now just to share information with our community about the ones and onlys. And I'm going to talk a little bit about just a few of them. So this one is, we are the only level 1 trauma center in the state. That means we provide the highest level of trauma care. If you're in a car accident, if you fall out of a tree while you're hiking, if something happens to you, we are here for you. And if we can't provide the service, it's not available anywhere else in the state. That's really important when you think about, sometimes people, when they think about the mill levy, which there's no increase in taxes from supporting this, but it is a maintaining the current tax amount. And, you know, taxes are something people are sensitive about. And so they want to make sure that this is a service that applies to everybody. Trauma applies to everyone. It can happen to anybody. And we're really good at it. There's 130 trauma centers in the United States, okay? We're in the top 10% in terms of how busy we are. Now, that's not good. That means a lot of people are having to come to us for these important services. But we also see more severely injured people. We're in the top 5% in the country in terms of the severity of injury that we see in our trauma center. So when you put those two things together, you think, wow, you're busy and people are more severely injured. How are we doing at that? There's a measure called mortality. which says of the people who come to you who were likely to die, what percentage of them did die, right? So one, that measure of 1.0 means that you're about at the average of people who were not expected to survive, okay? We're at 0.77, which means that we do so much better than anybody would expect for the severity of injuries that folks have when they come to us. We are the safety net, literally, for trauma in New Mexico. Next slide. We're also the only children's hospital in New Mexico. We have specialties and subspecialties for kids that there aren't available anywhere else in the state. And that's important because if we can't provide that service, families have to travel out of state, and a lot of families can't do that. It's really important that we be able to have services here for families and for kids. And we're really proud that we're able to do that. So we're very excited about that. Next slide. We're also 24/7 behavioral health care. And you can see from my little Zoom background, we have the Behavioral Health Crisis Center opening in just a few weeks, actually. It'll be opening in June. So just continuing to expand the availability of that very important service. You know, since COVID, I don't know if you saw the picture on the presentation, a lot of things have happened, right? I've gotten older, my hair's gotten grayer, but the whole community has also realized we need a lot more behavioral health care. And so we've been really fortunate to be able to provide that in partnership with the county. And that's a really important service for all of us. And I think people are really starting to recognize that and access it more. There's less stigma and there's more desire to access that care. Next slide. So here's a couple of fast facts that you might not know about us. Everybody knows we do trauma. Everybody knows we do children's care. Pretty much everybody knows we do behavioral health care. What you might not know is the reason why we have this mill levy and why we've had it since 1952 is because a long time ago, back then, the Indian Health Service and Bernalillo County partnered to provide a hospital for our community. So we are the Albuquerque area IHS hospital. There isn't another IHS hospital in the Albuquerque area. We're the Bernalillo County Safety Net Hospital. Some of you may remember when we were BCMC. We still have that identity, right? And we're designated by CMS as an urban rural teaching hospital, which sounds like a paradox, but it's because we serve everybody. We serve our whole state. Next slide. I just want you to be really proud of what we do here. We are unique. When you see those three circles, there's other IHS hospitals all over the country. There's other safety net hospitals in lots of counties. There's other academic medical centers in lots of places. We're the only hospital in the country. I mean, I'm serious. We're the only hospital that stands in all three of those circles. And we are so proud to be able to provide that service to our community. And we're so grateful for the support the community has given us through the mill levy over the years. So we appreciate you making the time for us. Thanks for listening. And I'm going to turn over to Dean Godwin, who's the Dean of the College of Pharmacy.
Thanks, Kate. I thought my hair's also gotten grayer since that picture that they used for the. I remember that hair color. So I'm here to talk today just briefly about the UNM College of Pharmacy renovation. So next slide. I'm going to start in the past. So this was the original College of Pharmacy building on main campus. It basically sits across from Hodgin Hall. It opened in 1945. So we are the oldest health profession school at the University of New Mexico. Nursing started about 10 years after us, and medicine about 20 years after us. The building still stands. It's actually a historical building. It was designed by John Galmeen. And currently, I just checked the map today, and it's currently labeled as the Biology Annex. I'm not really sure what that is, but that is still the College of Pharmacy past. Next slide, please. So our current building, and so for the present, this building opened in 1975. So we're pushing 50 years old now. You see that we do share it with the College of Nursing, hence the College of Nursing, College of Pharmacy letters on the side. I started here in 1996 as an assistant professor. And when I started in 1996, the entire College of Pharmacy was in this building. Not only in this building, we were in the basement and the first floor, and that's about it. We've expanded so much in the last 28 years since I've been here that we're now spread across 7 buildings across the Health Sciences Center. And I've seen, I mean, even with Zoom today and email and everything, we still just don't have that sense of collaboration that we did when I first got here. And that was what I think was really something that was very special about the college. So next slide. So let's talk about the future. So the future is a remodel, right? So we were not building a new building. We did do a engineering check, and the building was determined to have good bones. So we were going to renovate it. And again, so we're not going to have a new building a footprint increase. So we're going to be keeping the same building square footage. Of course, we are going to gain space, as President Stokes said, when the College of Nursing moves into the nursing public health or population health building later this summer. So the College of Pharmacy is going to gain some space, and we're going to go down from 8 buildings to get down to 3, which I am very happy about. So I will take that anytime. Next slide. A little bit about the College of Pharmacy that you may or may not be aware. We are New Mexico's only pharmacy school. So we prepare future pharmacists for essential healthcare roles. Again, what do pharmacists do? They focus on optimizing patient care and medication safety. New Mexico has one of the most advanced pharmacy practice laws anywhere in the country that allows pharmacists to do things in this state that they can't do in any other state in the country. I could spend hours just talking about that, but I'll stop there. We also have an undergraduate program. So we have a Bachelor's of Science in Pharmaceutical Sciences. So this is for students who are interested in working in the pharmaceutical industry. So and whether that's for the pharmaceutical or biomedical industry. So I think that's economic development, that's workforce development for New Mexico. And we also have a graduate program in both pharmacoeconomics and also pharmaceutical sciences that also is an economic and workforce growth mechanism. Speaking of our research, again, the College of Pharmacy has literally, and I'll give you some numbers here in a minute, literally one of the best research programs in the country. We are currently number 4 in NIH funding out of 140 colleges of pharmacy. I like to tell my fellow deans that my college has the highest ranked research program of any college at the University of New Mexico. And really what we do is we look at problems that hit New Mexicans. So again, we're elucidating causes of diseases, developing new drugs and treatments that really benefit New Mexico's diverse communities. Specifically, we have a huge research presence in substance use disorder, in the prevention of and treatment of substance use disorder, opioids, methamphetamine, cocaine, alcohol, you name it. And we also really have a large presence in environmental toxicology, particularly in metals exposure from uranium mining in the Navajo Nation and across the Pueblos, but also just the high levels of arsenic that we have in New Mexico in our soil just naturally. And our latest research area has been in microplastics. And I'm not sure if you've seen some of the coverage of our microplastics work. Every time I read another study, it just scares the crap out of me because I think microplastics might be the answer to everything that's been going wrong. So again, we're continuing with that research. Obviously, pharmacists have collaborative healthcare, always part of the team, working with physicians, physical therapists, nurses, nurse practitioners. Again, we integrate pharmacists into interprofessional teams to enhance patient care and also importantly, reduce costs of patient care in our state. Public health challenges, obviously New Mexico has got a lot of public health challenges, and the college implements outreach and services in underserved areas to improve health equity and outcomes. While not on the slide, the New Mexico Poison and Drug Information Center also falls under the umbrella of the College of Pharmacy too. So you know that we serve the entire state through that. And again, my college, my faculty, my staff, my students are very involved in policy and advocacy. Again, we're in Santa Fe, we're in DC, advocating for better patient care, medication access, and health system reforms at all levels. Next slide. Just a quick picture of the map. So you see where the project location is. It's really in the heart of the Health Sciences Center. We're right between, right across the plaza from the medical school, just south of the library. And I like to say one great thing about this renovation project is we're not taking any more parking. And I think that is very important to not take more parking from the university. People are very excited about that. What will this renovation do? Next slide. So we've already taken, it was about a 6-month process. We did a really robust and inclusive investigation. Again, engineering to make sure the building was worth renovating and didn't need to be torn down and rebuilt. But what do we identify that we need? Well, we really need improved technology in classrooms and enhanced laboratory infrastructure to really support our education and our research. Basically back in 1975, wellness and collaborative spaces and engagement was not really that big of a concern. We want to make this a place where the faculty, staff, and students want to hang out and meet with each other and talk and have those conversations that are going to lead to discoveries. Again, modern student gathering spaces, more active, flexible classrooms. It turns out that the nursing and pharmacy building on a per square foot basis is the most expensive building to run in the entire university. We need new HVAC. We need to upgrade our electrical system. We need to upgrade our IT. So a lot of the renovation is going to be those systems that we really need to upgrade. Again, enhanced interdepartmental collaboration and co-location, and again, informal student-focused common areas. There's our fourth in NIH research funding. Currently share a building with College of Nursing and have presence in 7 other buildings. And again, this would consolidate our program, furthering research, education, conversations, and collaborations. Next slide. So you'll see this is a 3-level or a 4-level building. If you count our basement level. And right now, nursing occupies the 2nd and 3rd floor, and we share the 1st. So once nursing moves out at the end of summer and over fall semester, we will start renovating those areas. The good news is we're actually going to be able to stay in the building. We're not going to have to evacuate it or relocate the people for the most part, because they can do a lot of this work while people are in the 2nd and 3rd floor, because that'll be totally vacant. We're really trying to make this as cost effective and minimally disruptive as possible. So we want to make sure that we're going to try to do this all at once. So what the ask was on the next slide, my last slide. So the original funding request was $57 million through a general obligation bond. You see that we already did put in some money. The HSC has put in $3.3 million towards the design, drawings and everything for this. And then again, you see the design over 14 months, construction for 16 months, full occupancy in late 2026, early 2027, depending. So what was approved by the legislature was a $35 million GO bond, and the College of Pharmacy is absolutely grateful for that bond. And again, assuming voter approval in November, we will start that renovation of phase 1, which is floors 1, 2, and 3. We've already started the design work. We've chosen our architect and we've chosen our contractor. So now it's just, now we're just going to keep going with the design. And once that bond is approved and the bond is sold, I said I'm going to spray paint a sledgehammer. We're not going to have a groundbreaking. So I'm going to spray paint a sledgehammer gold and, put a hole in a wall somewhere that's safe. That'll be the kickoff. So hopefully President Stokes will attend our wall breaking. But again, so we will not be able to do the complete renovation. We are going to be making an additional ask to the legislature for about $28 million, which will focus mainly on the basement. That is all wet lab space. And if anybody knows laboratory space, wet lab space is extremely expensive to renovate on a per square foot basis. But again, once we get that, and hopefully, and the funny thing is, even if we get that ask in the next legislative session, we will still be able to complete the entire project by 2027. So that won't even slow down our timeline. So again, that is my presentation, and now I will turn it over to Dean Mallett.
All right, thank you. So I'm Jennifer Mallet, the Dean of the College of Arts and Sciences, which is the largest academic unit at UNM. You can see Don and I have some competition. All the deans like to claim what they can for the greatness of their college. But in the College of Arts and Sciences, we have the natural sciences, the social sciences, and the humanities, and altogether 23 departments, one school, a lot of museums and centers, 70 undergraduate academic programs, and 37 graduate programs. So it's very big. And if you want to go to the next slide, what we are talking about here is about a replacement of the humanities building. So the humanities are obviously a really critical part of education at UNM. And this building, so if you're familiar with campus, this is right across from Zimmerman Library. Some people have told me that they think of it as the Jenga building, and I think that's funny, like that game where you pull the wooden pieces apart. It kind of does look like that. So we are going to be asking voters to consider a general obligation bond to fund the replacement of this building. So if you'll go to the next slide. We will talk about the rationale, which can be sort of a tragic tale, but I will tell you about what we're excited about after the tragic tale of this building. So it was built in 1971, and like many poured concrete buildings and campuses across the country, it is not held up well. Unlike Don's building, which I'm jealous of, your assessment was it had good bones. The assessment of ours is not that. This building it's in constant need of repairs. It requires asbestos abatement. It is not accessible. There are safety issues. It has poor energy efficiency. Folks just don't like being in there. There's a flooding problem, both from above and into the lower levels when it rains. So a lot of challenges in this building. So the assessment concluded that it should no longer be renovated. And one other issue, I mean, these are sort of structural issues, but one other challenge this building faces is that the layout of it just doesn't work for our modern academic mission. It is not set up for collaboration and interaction among people in the building. So it has been recommended to be replaced. So go to the next slide and skip this one, and we'll look at some pictures. So I feel like these pictures don't do justice to some of the struggles of this building, but we do have them here. There's some pictures that show you some of the challenges with the flood damage. And if you go to the next slide, it shows some issues with outdated classrooms and deteriorating offices. And this picture on the left, I'm going to say a couple things about it. This space is where the sign language interpretation program is located. And this is an accredited program. It has enormous student demand. The jobs that students get coming out of this are good jobs. There is a lot of demand for sign language interpretation. This picture makes the room look big, which it's pretty big, but it also sort of captures, if you notice, how low the ceiling is. If you go in that building and you're in that space and you're very tall, it is very claustrophobic. But in any case, so these are some pictures of the building, the humanities building. And if you want to come over for a tour, I'll give you a tour, and I'll take you on the part of the tour, not in the pictures, but that the departments insisted on showing me when I arrived, which is the bathrooms, which they feel is the most bleak aspect of this building. But the good news is we're thinking about the future, and it's really exciting to think about what that is. So you'll go to the next slide. I think we have a map that shows where the humanities building is, right in the heart of campus, with across from Zimmerman Library, right next to the Student Union building. And what we're imagining is a space where students are learning all of the skills that they need, critical thinking skills, communication skills, right in the heart of campus. And the goals for this building were developed through collaboration with faculty, staff, and students. And what we want to see in this space is a building that provides a flagship quality educational experience for UNM students. I want students to see that we're as invested in their future as they are and as their families are. And I'm excited about a new building that will show that. I also am excited about the possibility of having interactive spaces, spaces for students to be interacting, faculty, and the community, everyone coming together in these spaces. It lists on the slide the solitary work that some humanities scholars do. They write books and they, that is work that one does alone. But one thing I want you to know is there is tremendous interest in community engagement, in how we connect with the public and with the community. And that is part of the thinking that has been happening about this space, is how it is community space as well. And we also are thinking about technology in this space. We want to have space where the classrooms can support in-person learning, virtual learning, and hybrid learning, and also spaces where people can collaborate and think about how to use technology to communicate ideas that come out of the humanities and the social sciences. And all of this, we are also planning for how it represents the diverse cultures of New Mexico. So all of this, in the end, we expect will help improve recruitment and retention and graduation and prepare students for jobs in the future. Okay, next slide. And all of this, you could be imagining, is about students who are majoring in the humanities. And you can see there are many, 1,000 humanities majors, 900 social science majors. And certainly this will have a big impact on their lives. But the impact goes way beyond people majoring in the humanities or the social sciences. There's a little bit of jargon on this slide, but that SCH stands for student credit hours. So this is saying that we teach 26,000 student credit hours per term are taught in the humanities and social sciences to nearly 9,000 students every semester. And so we are touching everyone. And the reason that this is because in the College of Arts and Sciences, we serve the whole university through general education. The classes that students take to meet their humanities and social science requirements, they get those courses through our college. And these are the classes, like I mentioned before, that help students think about, develop their critical thinking skills, teach them how to write, teach them to think about, how we take another person's place, and helps them learn how to interact well in groups. And so we're serving nursing students, engineering students, pharmacy students, business students, as well as students who are in the College of Arts and Sciences. And maybe I should have mentioned sooner, the humanities and social sciences at UNM, we're talking about English classes, philosophy, Native American studies, Chicana and Chicano studies, foreign languages, the social sciences, so political science, sociology, lots and lots of disciplines that bring students really important perspectives and help prepare them for the world. So next slide. So this is a timeline. Having just arrived, so I just arrived at UNM in August. And so to me, it feels like everything's happening fast, but that's sort of because I've gotten on a moving train. But I see President Stokes shaking her head that it isn't happening as fast as I feel, but things are happening because we want to be ready if we receive the GEO bond funding so that we're ready to go. So we are already, unlike the pharmacy story, we do have to relocate people. So we are already working on where people will be relocated to during the construction period. We're preparing contracts for the demolition. And we are optimistic about a new facility that will serve all UNM students and prepare them well for their futures. So now I will turn it back over to Terry.
All righty, very good. Thank you, and thank you, President Stokes and your team for being here with us today. What a great presentation, very informative. We're going to move now to a few questions. And for our audience, if you're logged in today and you have a question for our panel, please drop it in the Q&A box on your screen, and we'll get to as many of those as we can. In the meantime, let me start by asking a question that all of you are welcome to respond to. And that is, we expect a lot from our flagship university as well as our only level 1 trauma center hospital. What will voting yes on the upcoming mill levy and GO bond questions mean to average New Mexicans? Can you help us understand why we all need to step up and approve these measures on this election cycle? And maybe start with you, President Stokes, and then any of your team that want to share their thoughts on that question.
Well, we are, really excited that this will be in front of voters in November, and we hope that they'll remember the university and that we'll have that people will be able to tell the stories of what these projects represent for us going forward, how they in various ways. What's interesting about the things that we're talking about today is how different they are and how they serve different parts of the state and different needs of New Mexicans. So what I'd like to do is just turn this over to, and ask the panel members who I think can speak, specifically a little more about what a difference this could make.
Okay, I'll
If
go
it's
first.
okay. First, I'll go first because mine's going to be the negative, and then the other two can speak positively.
All right, fair enough.
No. So when I've been in this role since 2018, and one of the questions that I got quite a bit when I first got here was, well, what if you didn't have the mill levy, right? What would that be like? What would you stop doing? And the answer is the mill levy is about 10% of the hospital's entire budget. So if you think about just taking out 10% of the employees, 10% of the services, 10% of the capacity, what that means is you can't provide as much access as we're providing now. The hospital now runs at about 120% of capacity. So if you imagine cutting everything by 10%, that means those patients have to go somewhere, and they're going to be waiting in our emergency room, and they're going to be waiting in other emergency rooms because 10% of the people won't not get sick, right? So I know that's kind of like a awkward way to say it, but the mill levy is an integral part of the hospital's budget. And so without that, we would really be looking at having to cut 10% of the services that we provide. Sorry.
No, thank you.
Jennifer will have something happier.
That's good clarification. I think sometimes people tend to think that these funds are for capital projects only, like were highlighted a lot in this presentation today, but your answer points out, you're saying it's 10% of the operational funds for the hospital.
Right. And I think sometimes people forget that our Hospital Funding Act in Bernalillo County specifically says that the mill levy is for operations and maintenance of the hospital. So we can't use it for capital, and we can only use it to provide services.
Very good. Okay. Don, you were trying to jump in. Go ahead.
Yeah, specifically for the College of Pharmacy GO bond, we will be able to train more pharmacists. And again, we need more providers. Pharmacists in this state, they can provide primary care. They can provide immunizations. They can do test to treat. You can walk into your local pharmacy and get a flu test, and if it's positive, you can get your antiviral prescription right there. Same thing for strep throat. Same thing for COVID. And we need more pharmacists, not only in Albuquerque but all around the state. And again, this will help increase the providers. This will This will hopefully, ease access to other providers, nurse practitioners, physicians, primary care docs, whomever. But also, again, it would also allow us to do more research. And again, and like I said briefly before, I mean, the research we do, we really do look for research that is going to affect New Mexicans disproportionately. That's why I focused on substance use disorder. That's why the College of Pharmacy has had a 3-decade-long focus on environmental toxicology, and we've strengthened that even more recently. And if we have the space and we have the facilities, the labs, the offices, the collaborative spaces, we can just do more. And we can do more, and we can help more New Mexicans, and that also will help with economic development. Again, what I said with that fourth in the country, that's $22.5 million in direct spending for research. And we employ probably over 150 people in our research operation, technicians and those kind of things. So a more modern building with an HVAC that works, and an electrical system that doesn't keep overloading, because we've added so many we put in a integrated molecular analysis core that's got probably, I think it's up to like $12 million in all kinds of highfalutin bioanalytical machines that I barely understand. I know what the acronyms are, but I have no idea how they work. But we've had to upgrade the electrical panels because it takes so much power that it was overloading the system. We need to be able to do that across the building. Our IT. I don't have internet, and I don't have Wi-Fi in my office. So I'm always running off my data, just because I'm way in the back and we have concrete walls. So again, just better, more. We will do more across the patient care aspects, education, and the research across the academics.
Hey, very good. And Jennifer, did you want to add to the
I would, because I think I bring an additional perspective as well. We all serve different groups in some ways. And there are a lot of advantages that would come from a new humanities building, but the one that I think about the most is students. And because students are engaging in these courses, not just if they're majors, like I said, but our first year students in all programs enter in, they take some of these general education requirements, which means that they're coming into the humanities building. And we know that students are more likely to succeed if they feel engaged when they arrive on campus, if they feel like they belong, and when they're interacting with other people. And so imagining a new building that is bright and engaging, where there's interaction among students and faculty and community, it is just so exciting to me to imagine how that will improve students' experience, that it will show them that they are in the right place and that they belong here. And so better retention in those first years leads to better graduation rates and a more educated New Mexico. So there are long-lasting effects for getting us, if we can get our new humanities building.
And I'd like to add something that, Jennifer wasn't able to really demonstrate here, the drama of actually talking about this facility when you can do this in person. The facility, she gave you pictures and told you all the things that are wrong, but what she didn't show you are that, on a fairly regular basis, pieces of this building just kind of crack off and fall down. So when we were making a presentation for arguing for this facility, one thing we could say is that, well, the Legislative Finance Committee will not let us put any more money in this building. It has to go. But the second thing is we were able to bring in pieces of the building and throw them on the table with great dramatic effect. And I wish we could do the same for you today, because most people don't realize just how challenging it can be to get the support that is necessary to really build cutting edge facilities to better serve our students and ultimately serve the state.
Yeah. I also want to say that we are one university, and I know that President Stokes has pushed that since she became president in 2018, and I am 100% behind the humanities building. 60% of pharmacy students come from UNM, so come from main campus. My son graduated from UNM in 2022, and took classes in the humanities building. Wasn't real happy about it. So again, I think this is, I think, sometimes we have health sciences center and we have main campus, right? We are one UNM and we support each other moving forward. And I hope the business community of Albuquerque realizes that we are one university, and we are the university for New Mexico. And what's good for the College of Arts and Science is good for the College of Pharmacy, School of Medicine, College of Nursing, School of Engineering. What's good for one is good for all.
That's wonderful. You know what, Bruce, let me ask Kate a quick question. And it deals with our conversations that the business community has all the time about making sure that we are competitive as a city and state for the recruitment of jobs here and existing growth of our current companies. And at the top of that list is our medical system and medical professionals. It has a direct relationship to our ability to compete and be successful in creating jobs. So I'm interested to know what you think the mill levy will do to help us with the shortage of medical professionals.
Oh, thanks so much for that question, Terry. So medical education, and this is true for medical education, nursing education, all of those pieces. It has two parts, right? The first part is kind of studying. It's the part where you're reading books and learning and memorizing, or, reading your computer nowadays. But the second part is kind of an apprenticeship, right? You're actually practicing in a clinical environment with someone supervising you doing that work. And that's how people really learn. And that's true across the country. And so both medical students and residents, the people who've graduated from medical school and are finishing their training, they have to work in a clinical environment. So it's our ability to provide that clinical capacity that enables the schools and the residency programs to continue to expand. And I'm really proud to say that President Stokes has made it a priority for her to make sure that we're focusing on how we can expand the healthcare workforce. And so over the last several years, because of significant investment by the state and by the county and by the university in physical capacity, like the crisis center behind me, we've created that additional space for education of trainees. And now by using the mill levy funding for continuing that operations and that expansion into that space, that means we're able to train more people. And that means we're able to produce more doctors and nurses and everything else for the state of New Mexico.
Great, thank you.
Okay, I'll ask this next, well, let's see. I'll ask this next question of Dawn. And you touched a little bit on this, but maybe we can go a little bit further. Anyone who uses a pharmacy understands how short-staffed they are and how many more pharmacists we need statewide and here in the Albuquerque area. Filling that need takes not only capacity, but great facilities for our pharmacy program. How will the bond issue help address this shortage? And again, I know you touched on that a little bit more. Anything else you'd like to say on that, Don?
I think great facilities will attract great faculty. We already have great faculty, so maybe we'll retain great faculty and attract new great faculty, and that's going to attract great students. There are some issues, in pharmacy, just in general with, you've probably heard about reimbursement and pharmacy benefit managers and, and all these kind of things about scope of practice. But I really do think that New Mexico is on the verge of a renaissance for pharmacy. I'm happy that, our applications went up 20% from the last year to this. So I really do think we're going to start producing more pharmacists, more pharmacy students. And, you're going to start seeing those staffing issues decline. Like I said, there's, the major chains, the independent pharmacists, they're making changes as well. They're battling with the PBMs right now to get what I would consider to be fair reimbursement for not only the medications, but also for the cognitive services, the dispensing that goes into that. But but you also have to see, but there's also, hundreds and hundreds of pharmacists just in this state that work in hospitals and work in ambulatory care centers and do work for some of the insurance companies, to really optimize medication therapy. And we train our pharmacy students for all of that. Again, I think community pharmacy is the front door of pharmacy, and that's what you see when you walk into a drugstore. But what you don't see is the work that's being done behind the scenes in the hospital, or for the clinical pharmacists that are on the state, on the floors, rounding with the physicians and the nurses. Again, just to make sure that all of the medication therapy is being optimized, and that is going to increase patient or better patient outcomes and lower costs as well.
All right, excellent. Thank you. Well, President Stokes, this has been an excellent conversation. I want to thank you for all the information that you all have prepared and shared with us today. Before we close things out, I want to provide you with an opportunity to have any closing comments you'd like to share. Briefly, we are a little bit behind schedule, but still ahead of our 4 o'clock finish time. So go ahead.
Well, thank you. And actually, the last words I'd like to say are just that. Thank you. We are grateful to the business community, the chamber, the community at large for their support for the university. We very much believe in being the University for New Mexico, and just grateful for the opportunity to share some of what's ahead, some of where the institution is going. And I just want to say too, never hesitate to let us know how we can be serving this community and this state better, because that's what we're here to do. So thank you.
Great. Thank you very much. Well said. Terry, take us home here. Close us out.
You bet. So thank you, Bruce. A big thanks, President Stokes, Kate Becker, Dean Godwin, and Dean Malott. Thank you so much for being with us today. Our chamber is a community-minded place. We seek partnerships to solve problems that are facing our community. And we make progress in education, workforce development, healthcare. We can't do that without the tremendous support we get from the business community and from the people who sponsored this event today and the many other sponsors we have throughout the year for our programs. We have a couple of events coming up, and I hope you'll join us June 12th, where we'll hear from the new APS superintendent, Dr. Gabriella Duran-Blakely. And then on June 25th, we will have Mayor Tim Keller join us. So we invite you to join us for those programs. And I think, everybody, this concludes our meeting today. So thank you for joining us. Have a good rest of your week.